and I want to pick up where I left off, that question of what more can we do as it relates to contact tracing, as it relates to testing, as it relates to supporting individuals in need before we have full vaccination across this country. And narrowing in specifically on rapid tests, how many rapid tests have we delivered to the provinces?
So in regard to, Madam Chair, in regard to rapid tests, as of January 31st, we had delivered 17,686,000 rapid tests to the provinces. That includes the Abbott ID Now, as well as antigen tests by several manufacturers.
And my understanding from media reports is that Ontario, as an example, which is where I am, has used only a fraction of the rapid test that it has received. Given I have sat in the House of Commons in question period, and I have felt that insistence myself to say we need more rapid testing until we have a vaccine rollout in a fuller way. Why is it? I mean, you're in communication with your provincial counterparts. Why is it that they're not using the rapid tests that have been delivered to them?
Madam Chair, I first note that it is critically important, as noted, that public health measures coupled with testing and screening, contact tracing and isolation of cases and contacts, as well as vaccination, all continue in the work to control the pandemic. In regard to working with the provinces and territories, we have worked very closely in terms of providing information on the use of those tests, provided guidance in October, have established four to work on understanding how they can be used and sharing lessons learned. The use of the test is increasing day by day. For example, in the fall, Nova Scotia used the antigen tests in pop-up settings associated with some bars and restaurants downtown to test people, and to good work. Ontario has worked with them in workplace settings with employers, and so we're seeing that in work increase, and through providing the tests, guidance, and establishing through convening provinces and territories with experts a means of doing that. And I would just conclude saying, as well, we've provided further guidance through the expert panel on testing and screening that Minister Haidu convened, and they released a report recently.
I'm familiar. Yeah, so I'm familiar with that report. The co-chair, Dr. Irfan Dalla, is brilliant. He happens to be a constituent, and he said we need the federal government to procure more of them. We need the federal government to approve more of them, and then we need the provincial governments to support the more rapid use and wide-scale use of them. Do you agree with that statement?
Yes, Madam Chair, we are working to procure more tests. We have further ones in our regulatory pipeline, and working closely, as I noted, with the provinces and territories to encourage and support in all regards their use, as well as with other interested parties to support their use for screening as well as testing purposes.
And as it relates to screening, I want to narrow in specifically as we look at reopening our schools. And here in Ontario, here in Toronto, a hotspot, the provincial government has not been so clear with parents about how schools are to be reopened. One would think, though, what we know today is that you would have a clear rapid testing regime using screening to say for teachers and potentially even for students multiple times a week, you're going to have sufficient rapid testing to screen the individuals who are having to go into the workplace. And have those conversations been active with the province of Ontario? And if so, do we have enough rapid tests at scale for that kind of reopening to happen?
Madam Chair, we are, as noted, working with the provinces on different use cases. Some of them are indeed looking at schools or universities as settings for screening on an ongoing or regular basis. We're working with them in terms of understanding that demand, and have proactively procured tens of millions of rapid antigen tests, for example, to address those and other settings.
And the last question, I suppose, just on human resources. There was some media reporting in relation to tens of thousands of Canadians have stepped up to serve as it relates to contact tracing or otherwise, but have not been put to full use. Can you give an update to this committee of where those efforts are at and how Canadians can step up to support these efforts?
Thank you, Madam Chair. indeed, in the spring, Health Canada launched a national volunteer recruitment initiative and had extraordinary support from Canadians. It was followed up and information provided to the provinces, for example, for support in long-term care. We've gone back to people in the inventory to confirm interest and are working again with the provinces on people who may be interested, for example, in helping out in the vaccination campaign in functions where their experience and qualifications would support it.